Every time you use the bathroom, you might think it's just a routine, flush and forget. But here's the shocking truth. Your urine could be silently screaming for help. In the United States, more than 37 million adults live with chronic kidney disease, CKD, and an estimated 90% don't even know they have it. That's almost 1 in 7 Americans walking around with damaged kidneys, completely unaware. Why? Because kidney disease is known as the silent killer. The early signs are often subtle, and the most overlooked warning light comes from your own urine. Every color, every bubble, every frequency tells a story. Yet most people never pay attention. By the time obvious symptoms show up, fatigue, swollen ankles, high blood pressure, the kidneys may already be functioning at less than 20%. At that stage, the only options are dialysis or transplant. But it doesn't have to be that way. If you know what to look for, your urine can reveal early red flags, long before irreversible damage sets in. Today, we'll uncover 5 alarming urine symptoms that may mean your kidneys are in trouble, and what you can do to protect them. Welcome to Health Facts. Welcome to my health channel. Subscribe, like, share, and comment as we reveal the hidden truth about what your urine is telling you, why kidneys matter. Before we jump into the warning signs, let's take a step back. Why are kidneys so important? Your kidneys are 2 bean-shaped organs, each about the size of a fist, located just below your rib cage on either side of your spine. They may look small, but they're powerhouses. Filtration. Every day, they filter about 50 gallons of blood and produce 1 to 2 quarts of urine, removing waste products like urea, creatinine, and extra salts. Fluid balance. They regulate how much water your body keeps or releases. Electrolyte balance. They manage sodium, potassium, and calcium, crucial for nerves and muscles. Blood pressure control. They release hormones like renin that regulate blood pressure. Red blood cell production. They release erythropoietin, which tells your bone marrow to make red blood cells. Bone health. They help activate vitamin D, essential for strong bones. Without kidneys, your body would be poisoned by its own waste in just a few days. Here's the scary part. In the US, kidney disease ranks as the 9th leading cause of death, and it's not just older people. High rates of diabetes, obesity, and hypertension are pushing kidney problems into younger populations. Even teens and people in their 20s are being diagnosed with early kidney damage. Your kidneys never stop working. The question is, are you giving them the protection they deserve? How kidneys work, the body's natural filter. Imagine your kidneys as a high-tech water treatment plant. Each kidney contains about 1 million tiny filtering units called nephrons. Every nephron has a filter called the glomerulus and a tubule. The glomerulus lets waste and water pass through while holding back proteins and blood cells. The tubule then fine-tunes the mix, deciding what to keep and what to excrete. The result? Urine, a liquid snapshot of what's happening inside your body. Clear, pale urine usually means healthy hydration and balanced kidneys. Dark, concentrated urine may signal dehydration or even disease. Foam, blood, or strange colors could mean kidney damage. Think of your kidneys as employees working 24/7 without breaks. They don't complain until the workload is unbearable, and when they finally do, they speak through your urine. That's why paying attention to urine is critical. It's often the first sign something's wrong. Your kidneys are whispering to you long before they scream. The 5 alarming urine signs of kidney disease. Now let's dive into the 5 major red flags your urine may reveal. Foamy or bubbly urine. You've probably noticed foam in the toilet bowl after peeing. Sometimes it's just the force of the stream, harmless and temporary. But if your urine is consistently foamy or bubbly, day after day, that's a red flag. The foam comes from protein molecules in the urine. Normally, healthy kidneys keep protein in your bloodstream, where it belongs. But when the filters, the glomeruli, are damaged, protein leaks out into urine. This condition is called proteinuria. Why is this dangerous? Protein is essential for building muscles, repairing tissues, and fighting infections. Losing it through urine weakens your body. In the United States, proteinuria is one of the earliest and most reliable indicators of kidney disease. In fact, it's so important that doctors use a urine protein test, often called the albumin to creatinine ratio, as a standard screening tool. Mild proteinuria might go unnoticed. Persistent proteinuria suggests chronic kidney disease. Heavy proteinuria could mean serious conditions like glomerulonephritis or diabetic nephropathy. A real-world example, a middle-aged man in Texas with no history of kidney disease ignored foamy urine for years. By the time he got tested, his kidney function had dropped to 30%. He needed dialysis within 3 years. Foamy urine isn't just cosmetic, it's your body's SOS. If you see persistent foam, especially if it's accompanied by swelling in your ankles or puffy eyes, it's time to get your kidneys checked, blood and urine. Few things are as alarming as looking into the toilet bowl and seeing red or pink urine. But here's the chilling truth. Many people in the US ignore it, assuming it's from something they ate, like beets, or just a minor infection. But blood and urine, known as hematuria, is never something to brush off. Even if you can't see it, microscopic traces of blood are often detected in routine urine tests and can signal early kidney problems. Why does blood appear in urine? Because the kidney's delicate filters are damaged, or because something in the urinary tract is bleeding. Causes range from relatively harmless to life-threatening kidney infections, kidney stones scraping the urinary tract, enlarged prostate in men, glomerulonephritis, inflammation of kidney filters, polycystic kidney disease, kidney or bladder cancer. In the US, urologists often repeat the same phrase, blood in urine, until proven otherwise is kidney disease, or worse. There are 2 kinds of hematuria. Gross hematuria, when blood is visible to the eye, making urine pink, red, or cola-colored. Microscopic hematuria, invisible to the eye, detected only under a microscope or through lab testing. Even the smallest trace should not be ignored. A case example. A 45-year-old woman in California noticed occasional pink urine, but assumed it was from dehydration. When she finally visited a doctor, she was diagnosed with stage 2 kidney cancer. Early detection gave her a fighting chance, but ignoring the sign for months nearly cost her life. If you ever notice blood in your urine, even once, the safest step is to see a doctor immediately. In America, where kidney cancer is among the top 10 most common cancers, ignoring the symptom can be deadly. Urine color changes. Urine color is one of the most overlooked health indicators. Most people think if it's yellow, everything is fine. But your kidneys use color as a language, and when they're struggling, that language gets darker, stranger, and more alarming. Here's what different urine colors may mean for your kidney health. 1. Dark brown or cola-colored urine. This can signal the presence of blood or severe dehydration. It often indicates muscle breakdown, rhabdomyolysis, or advanced kidney disease. In the US, doctors often associate cola-colored urine with glomerulonephritis, a dangerous condition where kidney filters become inflamed. 2. Red or pink urine. As we covered earlier, this is blood in urine. Even if it happens only once, it needs urgent medical attention. 3. Orange urine. Sometimes linked to dehydration or certain medications, but it can also indicate liver or bile duct problems that indirectly affect the kidneys. 4. Very pale or clear urine. This can be a sign of overhydration, but if it persists, it may point to issues with how kidneys concentrate urine, a potential sign of chronic kidney disease. 5. Green or blue urine. Rare, but can result from medications, dyes, or bacterial infections. If persistent, it should be evaluated. The bottom line is this: healthy urine is typically light yellow due to urochrome, a pigment produced when your body breaks down hemoglobin. Any persistent shift away from this, darker, cloudy, reddish, can signal trouble. In a CDC survey, nearly 40% of Americans admitted they ignored unusual urine colors until the problem became severe. That delay often turned a treatable kidney condition into irreversible damage. Your urine is like a daily health report card. Don't ignore the red flags when the color suddenly changes. Pay attention before it's too late. Frequent urination, especially at night. Do you wake up several times during the night to pee? Occasional nighttime trips may be normal, especially after drinking lots of water or caffeine before bed. But if you're consistently waking up 2, 3, or even more times every night, it could be a red flag for kidney disease. This condition, called nocturia, often signals that the kidneys are no longer filtering properly. Healthy kidneys concentrate urine at night, allowing you to sleep uninterrupted. Damaged kidneys lose this ability, producing more dilute urine and forcing you to the bathroom. In the U.S., nocturia is frequently linked with chronic kidney disease, diabetes and high blood sugar, damaging kidney filters, enlarged prostate in men, which complicates kidney drainage, heart failure, fluid backs up, kidneys excreted at night. A 2019 U.S. study found that people who woke up more than twice nightly to urinate were significantly more likely to have undiagnosed chronic kidney disease. Beyond being a nuisance, nocturia disrupts sleep, leading to fatigue, irritability, and higher risk of heart problems. Americans already face a sleep crisis, and nocturia makes it worse. If you're finding yourself chained to the bathroom at night, don't shrug it off as just aging. It may be your kidneys begging for help. Painful urination or urgency. Burning, stinging, or pain when urinating is one of the clearest signs something's wrong. While most people think of urinary tract infections, the underlying problem could also involve your kidneys. Painful urination, called dysuria, may come from kidney infections, bacteria traveling upward from the bladder, kidney stones scratching the urinary tract, enlarged prostate in men, interstitial cystitis, chronic bladder condition that stresses kidneys, advanced kidney disease where inflammation irritates the urinary system. Urgency, the sudden overwhelming need to urinate, is another key warning sign. In kidney disease, the bladder often tries to overcompensate for impaired filtering. Here's a chilling U.S. case. A 38-year-old man in Florida ignored painful urination for months, thinking it was just minor UTIs. By the time he sought medical care, he had severe kidney scarring from repeated infections. His kidney function dropped so low, he eventually needed dialysis. The message is simple. Pain or urgency in urination is never just a bladder issue. If it keeps happening, your kidneys may be at risk. Other warning signs beyond urine. Your urine is one of the clearest windows into kidney health, but it's not the only one. Kidneys affect your entire body, and when they start failing, other systems start showing signs. Here are additional symptoms Americans often miss. 1. Fatigue and weakness. Damaged kidneys can't produce enough erythropoietin, the hormone that tells your body to make red blood cells. The result is anemia, leaving you constantly tired, weak, and short of breath. 2. Swelling in feet, ankles, or hands. When kidneys can't remove extra fluid and salt, it builds up in tissues, causing puffiness. Many Americans mistake this for weight gain or just aging, when in reality it's a major red flag. 3. High blood pressure. The kidneys regulate blood pressure through hormones. When they're damaged, blood pressure rises, and high blood pressure in turn further damages kidneys. It's a vicious cycle. 4. Back or flank pain. Pain in the lower back or sides can be linked to kidney infections, stones, or cysts. Persistent flank pain deserves medical evaluation. 5. Nausea, vomiting, and metallic taste. When waste builds up in the blood, a condition called uremia, it can make you feel sick, cause bad breath, and even change how food tastes. 6. Itchy skin and muscle cramps. Imbalance of minerals like calcium and phosphorus due to kidney damage often shows up as constant itching or painful cramps. The American Kidney Fund estimates that millions of Americans experience these symptoms but never connect them to kidney health. By the time they do, it's often late-stage disease. This is why watching your urine, along with the rest of your body, is so critical. Early attention saves lives. Risk factors in the U.S. Now that we've covered the 5 alarming urine signs and other body warnings, let's look at the underlying reasons so many Americans develop kidney disease. 1. Diabetes. High blood sugar damages the delicate filters in the kidneys. Diabetes is the leading cause of kidney disease in the U.S., responsible for nearly 40% of new cases. 2. High blood pressure. Uncontrolled hypertension weakens blood vessels in the kidneys, reducing their ability to filter. Nearly half of all American adults have high blood pressure, making this a major risk. 3. Obesity. Extra body weight increases the risk of both diabetes and high blood pressure, creating a double hit to the kidneys. 4. Excessive use of painkillers. Over-the-counter medications like ibuprofen and naproxen, when used regularly, can cause kidney damage. In fact, drug-induced kidney injury is a growing concern in the U.S. 5. Smoking and alcohol. Smoking reduces blood flow to the kidneys, while heavy alcohol consumption adds toxic stress. Both accelerate kidney damage. 6. Family history and age. If kidney disease runs in your family or you're over 60, your risk is higher. The tragedy is that many Americans don't realize they're at risk until urine symptoms appear, and by then, damage may already be advanced. Awareness of these risk factors is the first line of defense. Daily kidney-friendly lifestyle and prevention tips. So what can you do to protect your kidneys every single day? Here are science-backed steps that U.S. nephrologists recommend. Stay hydrated. Aim for 6 to 8 glasses of water a day unless your doctor limits fluids. Water helps flush toxins. Cut down on salt. Americans consume far more sodium than recommended. High salt increases blood pressure and strains kidneys. Balance protein intake. Too much protein can overwork kidneys, while too little weakens the body. Focus on lean proteins like fish, beans, and poultry. Eat fruits and vegetables. Potassium-rich foods like bananas, oranges, and leafy greens support balance, but patients with advanced kidney disease should monitor intake carefully. Exercise regularly. Physical activity improves blood pressure and weight, reducing kidney strain. Avoid smoking and limit alcohol. Both accelerate kidney decline. Get regular checkups, especially if you have diabetes, high blood pressure, or a family history of kidney disease. Routine urine and blood tests can catch problems early. The key takeaway: prevention is far easier than treatment. Once kidneys are severely damaged, the options narrow to dialysis or transplant, both life-altering. Sample day plan for kidney health. Let's put it all into a simple daily routine you can follow to keep your kidneys healthy. Morning, start with a glass of water. Breakfast, oatmeal topped with blueberries and flax seeds, plus green tea. Mid-morning, snack, a small apple or handful of unsalted almonds. Lunch, grilled salmon salad with spinach, arugula, and olive oil dressing. Whole grain bread on the side. Afternoon, drink water or unsweetened herbal tea. Snack, carrot sticks or cucumber slices. Dinner, roasted chicken breast with quinoa and steamed broccoli. Add a small serving of beets for antioxidant support. Evening, golden milk, turmeric plus warm almond milk, or chamomile tea. This plan balances hydration, protein, and antioxidant-rich foods while avoiding excessive salt, sugar, and processed snacks, giving your kidneys daily support. Recap of the 5 alarming urine signs. Let's recap the 5 urine symptoms you should never ignore. Foamy or bubbly urine could mean protein leakage, proteinuria. Blood in urine, always a red flag, may indicate stones, infection, or cancer. Urine color changes. Dark cola-colored or pale urine often signals kidney problems. Frequent urination, especially at night, may mean kidneys can't concentrate urine. Painful urination or urgency could indicate infection, stones, or kidney inflammation. Together, these signs are your body's way of saying, "Don't ignore me." Early detection and treatment can slow or even stop kidney disease progression. So here's the truth. Your urine is not just waste, it's information. Every flush could be showing you a snapshot of your kidney health. In the United States, where kidney disease silently affects tens of millions, awareness is everything. By paying attention to what your urine looks like, how often you go, and how it feels, you may catch the disease early enough to prevent tragedy. Your kidneys are small, but their role is massive. Protect them with healthy choices, regular checkups, and by never ignoring the red flags. Welcome to Health Facts. Welcome to my health channel. Subscribe, like, share, and comment if you learned something today, because knowledge is power and your health deserves it.